Thank you very much, Cahill. Minister, as I have outlined to you previously in representations and through parliamentary questions as well and other debates here, there are considerable delays in patients in Cavan and Monaghan accessing assessments and follow-up procedures for orthopaedics. I am very anxious that additional capacity be provided for those two counties and for the North East in particular. The figures that I got at the end of August indicated, unfortunately, a further increase from the previous numbers. So I'd like to know, Minister, what hope is there for additional capacity in orthopaedics area for patients in Cavan Monaghan for 2020?
Thank you very much, Minister.
I want to thank Deputy Smith for his important question in relation to orthopaedics in the Cavan Monaghan region. I'm very conscious that waiting times are often unacceptably long, and that this places a burden on patients and their families, and we are committed to improving waiting times for hospital appointments and procedures. Indeed, we've made some progress in relation to hospital operation waiting lists falling. The HSE advised that the acute element of the orthopaedic service for this region is currently provided through Our Lady of Lourdes Hospital in Drogheda. The elective component of the service is provided via the regional orthopaedic unit in Our Lady's Hospital in Navan, and consultants also work out of Cavan and Monaghan, which I know is the gem of the question here, to provide clinics for outpatients, for orthopaedic patients. I understand that the delivery of orthopaedic services in this region is being kept under review by the HSE. But more broadly, Budget 2020 announced that the Government has further increased investment in tackling waiting lists, with funding to the National Treatment Purchase Fund now rising to 100 million, as you know, an issue of importance to you. This year-on-year increase in the National Treatment Purchase Fund does provide opportunities to further improve waiting times. My department is now working with the HSE and the National Treatment Purchase Fund to develop the Scheduled Care Access Plan 2020. In this regard, the HSE Service Plan for 2020 will set out the planned activity level for the year ahead, and the NTPF will work with the hospital system to provide additionality to improve access to inpatient day case treatment, and with a particular focus on hospital outpatient services. In this regard, in a direct answer to Deputy Smith's question, I'd really encourage the individual hospitals and hospital groups to put forward proposals for that 2020 funding. We have a very significant access fund now of €100 million, and we will be inviting and indeed looking for, and hospital groups are well aware of this, proposals as to how they can do more in be it Cavan or Monaghan or other parts of the country. So certainly on the basis of the Deputy's question, I'll raise this directly with the NTPF and with the HSE, but I would encourage the hospital group to bring forward proposals, because if we can do more to drive down orthopaedic waiting times in Cavan Monaghan, I'm very happy to do so, and I do now believe we have a level of funding to make that a reality.
Deputy Smith.
Thank you, Peter. Thank you, Minister, for his reply. Minister, I would be very glad to see an improvement in the delivery of both assessments and follow-up procedures where they're necessary. We all have coming to us on a weekly basis people who are obviously in pain and suffering and who are still waiting on an assessment and follow-up procedure. And unfortunately, they're often told that if they were able to go as a private patient, they would have the procedure undertaken without delay. So, Minister, I welcome your commitment that there will be additional funding available for the hospitals in the North East region who have orthopaedic capacity, and I sincerely hope that if proposals are put forward, that they're acted upon, and that those additional services and additional capacity will be put in place in early 2020, and that we won't be talking this time next year again about funding having been provided but not yet drawn down or allocated. So, Minister, I'd like an assurance that when hospitals put forward realistic and viable proposals, that they will meet with a quick response, and that additional capacity will be put in place, because so many patients out there, some of whom may be listening to us today, who are suffering in pain, and oftentimes older persons, and their mobility is damaged as well. So it's important that we address this particular issue as rapidly as possible.
Yeah, look, I don't disagree with a word Deputy Smith said. I just would make the point that as of now I've been advised by the NTPF that the Cavan Monaghan Hospital has not submitted any proposals to the NTPF, so I would take the opportunity on the floor of the Dáil to encourage all of our hospitals, all of our hospital groups, and indeed our community health organisations to now bring forward proposals. You have excellent management and excellent staff in the Cavan Monaghan Hospital. I've had the pleasure of visiting both, and indeed meeting with you in Monaghan about how we can make Monaghan Hospital busier as well in terms of the capacity capacity there. But I would really urge both the Cavan Monaghan Hospital to now engage with the hospital group and to bring forward proposals for the NTPF. We have a level of funding going into 2020 now that should really make new proposals viable, and I would encourage them to do that. Cavan Monaghan General Hospital currently holds no orthopaedic patients on its inpatient day case waiting list for the reasons that I already outlined, but I think there are currently 86 patients on the outpatient day case orthopaedic waiting list who live in Cavan or Monaghan. 58% of the patients in this area are listed on the CAPA list. The latest NTPF lists show that of those waiting in CAPA, 93% are now waiting 9 months or less. So we are making progress on the inpatient day case. I think we need to make more progress on the outpatients, and I'd welcome proposals in that regard.
You wish to make a final quick comment?
Minister, I welcome that. Just, Minister, I welcome the additional funding that our party spokesperson has advocated very strongly for in the NTPF for the coming year, and I also welcome the progress that has been made with the cross-border scheme. But, Minister, one thing I mentioned during a health debate here previously, we have patients going to Northern Ireland to access services. We have at the same time, if you read any of the Belfast newspapers, as I do, read the nationalist newspapers in particular on a daily basis, there are advertisements from our private hospitals seeking patients from Northern Ireland to come to avail of the cross-border directive. Surely the department, yourself or the HSE could pull this together, and if there's capacity here to have procedures carried out, let them be carried out here instead of people having to head to Belfast or elsewhere in Northern Ireland, when there would be less cost if they were able to get those procedures undertaken in our own state. It doesn't make sense that we have clinics and hospitals in Northern Ireland looking to get our patients, and we have private hospitals in our state looking to get patients from Northern Ireland. Surely this can be managed in a much better way for the same amount of money.
Thank you. Final comment.
Yeah, just two things. The Deputy referenced the cross-border directive, and as a Border Deputy, I know he'll be particularly concerned and pleased with the work we've done in this House to protect the reciprocal health arrangements, even in the event of a no-deal Brexit. The Brexit Omnibus Bill that we passed here in April will mean that the reciprocal healthcare rights, people going from the north to the south and the south to the north, and indeed east and west, will continue regardless of the political environment that a no-deal Brexit could potentially bring us into. I don't disagree with the Deputy in relation to making sure we utilise all of the capacity here, though I would argue we're making a lot of progress in that regard. The NTPF no longer just spends its money on private hospitals, thankfully. It's put €1 million into Nina to open a new cataract theatre there, which is making real progress in that Midwest region. It's opened theatres in Bantry Hospital as well. Indeed, when I visited Monaghan, I was told at great length that there was a view that we could be doing more in Monaghan using the fund, but I do need to receive proposals from the hospital and the hospital group in that regard, or more specifically the NTPF do. And I'm satisfied now that we've provided the NTPF, working with yourselves, with a level of funding that they should be able to respond positively to such proposals.
Thank you very much, Minister.